Well, good afternoon, everyone. I'm Doug McGowen, representing the Joint Task Force for Memphis and Shelby County. I'm joined by Dr. Randolph today. I'd like to kick off today talking just about two things. First, about testing, and then second, about staffing, and then I'll hand it over to Dr. Randolph to talk about some of the data. So testing is important. Everyone should know their status. We have plentiful testing available here in the city of Memphis and Shelby County. Whether or not you have an appointment, whether or not you are feeling symptoms, you can get a test, and typically it's free. We have lots of availability during the week. We're only using 60 to 70% of our capacity. If you'd like to know where to get a test, go to covid19.memphistn.gov, and you'll see all of the places you can go and all of the hours that you can get a test. Leading up into the Thanksgiving holiday, we did some surge testing so that everybody could know their status going into those gatherings. We're doing the same thing as we lead into the Christmas holidays. Last weekend was our first surge test event, and we'll be doing those each and every weekend all the way up to the Christmas holiday. I want to give you just a little bit of data to show why it is so critically important for people to take advantage of the testing. The surge testing event that we had last weekend at just 2 locations resulted in 2,540 people, some of whom were symptomatic, but most of whom were asymptomatic, to come and get a test. The results of that testing were that 404 people out of those 2,500 came back with a positive test. That's 16% of the people that were tested came back positive. The vast majority of those had no idea that they were infected with COVID and would have gone about their normal course of business, interacting with other people, living their lives, and potentially spreading the virus. So please, take advantage of the testing opportunities that we have here and go get tested so you can know your status. This coming weekend, we'll have another mass testing event. It will be at 2 locations, 1720 RKS Commercial Cove, which is just off Lamar Avenue inside the 240 loop. It's an old vehicle inspection station. And then at Poplar Healthcare, which is out in East Memphis on Hacks Cross. That's an opportunity for people who are asymptomatic to go get tested and to know your status. We're going to look to expand those opportunities to the weekdays as well, if we can, and we're going to try to focus on those hours after work, so from 4 to 8 p.m. so that people can take advantage of that testing. So please, if the testing is available, take advantage of it. Second thing I'd like to talk about is staffing. That is a conversation of the day. It's happening all across the country. You all have seen the numbers go up in our hospitalization rate. Both acute care beds are being filled up, as are ICU beds. The question becomes, how do we expand our capacity at the hospitals? When might we open the alternate care facility to take care of those overflows? The issue is not with the facility, it's with available staffing. Now, early in the pandemic, the way we handled this in places like New York and other areas that were seeing a peak were that traveling nurses, contracted staffing agencies, and others could come to the aid of any one municipality that was seeing a peak. That was the model that was put into place when the alternate care facility was envisioned way back in the spring. Unfortunately, that model is not going to work for us now because our entire nation is at a peak. And so we are left with the staff that we have here locally. We may get 1 or 2 people who break free from another locality to come here, but largely we are fighting this fight with the people that we have here in Memphis and Shelby County and in Tennessee. And so my message for you today is that we need you. We need you to join the fight. If you are a licensed medical provider in any domain, we would like you to step forward and sign up to the Medical Reserve Corps for the state of Tennessee. There are both paid and unpaid positions. That is a formal way in which we can get you engaged in the fight and put you at the right place at the right time. If you are someone who is interested in helping but don't have any kind of a medical background, we need you as well. Today, there are far too many people with medical training who are doing administrative tasks. You've seen some articles in the paper about us even engaging medical students, nursing students, pharmacology students, and technical students to give immunizations. I call that force multipliers. Those are people filling the gap today, filling roles where medically trained people, medically certified people are used to give immunizations so that we can use those medically trained people in other roles to take care of patients. Similarly, if you have administrative skills and would like to volunteer, we can use you too. The last thing we need is for medically certified people to be doing any kind of logistics or administrative work. We can use you to help alleviate the burden so that we can better expand our capacity to serve patients who are in critical need of our care. The last message I will give to you is, please get tested, know your status, and if you are positive, isolate so that we never have to activate this alternate workforce because our hospitals are over capacity. With that, I'll turn it over to Dr. Randolph for some data.
Thank you, Chief McGowen. Greetings, fellow citizens, Shelby County. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I'm here to provide some update data as of December 8th, 2020. Our total Shelby County cases is 51,775. Of those 51,775 cases that we've experienced since this pandemic began, 91.8% have recovered, 1.4% have died, and 6.9% still active cases. So we've experienced 541 new cases today compared to yesterday. We also have experienced a total of 709 deaths over the period since this pandemic, which stated represents 1.4% of the cases. But within the last 24 hours, we have experienced 4 deaths. I also want to mention that we have conducted 697,668 tests. Of those tests that have been performed, 91.1% of them have been negative and 8.9% positive. Our positivity rate by week, the week between November 22nd through November 28th, showed a positivity rate of 12.8%. What that means is that the test that was conducted during that period of time, 12.8% of those tests were positive. We also look at a 7-day test positivity rate, and that rolled in 7-day positivity rate ending 12/5/2020 actually shows a positivity rate of 13.6%. I also want to state that we've experienced 51,775 cases. We have closed 45,247 of those, so 87% of those cases have been closed. But currently, we have 8,346 people in quarantine. That's really the update, and I will stop there and entertain specific questions that you may have.
Brad Broders, Local 24.
Good afternoon, everyone. Question for Dr. Randolph and/or Chief McGowen. Is there any new update regarding vaccine timelines, doses, prioritization, et cetera?
The vaccine plan is ever-changing. However, the preliminary situation currently is that we're anticipating receiving vaccine probably the mid of December, a couple of weeks. The healthcare systems will receive the vaccine directly from Pfizer. and the health department will receive vaccine, the Moderna vaccine, sometime shortly after that. We have put in place a distribution plan that we will execute once we receive the vaccine. Chief McGowen, do you have anything to add?
Shortly, we'll have that plan ready to distribute so everyone can see, but it is divided basically into 4 phases. Phase 1A1 is the healthcare providers, the people who are actually engaged in patient care and first responders. You can expect that nearly all of the first 2 shipments of vaccine that we receive will be targeted at that group, and that they are at highest risk. Following that will be people in congregate settings and workers in congregate settings. And so for the general public, it is still some time in the future, but as quick as they are shipping it to us, we will be putting it out into the field and giving it to people according to the prioritization. Now, the prioritization was developed by the Tennessee Department of Health. It relatively closely follows the federal guidelines. Everyone's doing it about the same way. So very shortly, you'll see how we're going to do that here in a localized fashion. I want to be clear that the very beginning of this, that we're not going to get a huge amount of vaccine. Again, only about enough to begin inoculating those frontline workers and first responders.
Thanks, Chief McGowen. And as I have you up there on the podium, you may know this, today is the 9-month anniversary since Shelby County reported its first confirmed case of COVID-19 here in Shelby County. I know you just kind of talked about the challenges ahead with staffing. I know you don't want to look backwards, but looking forward the next 9 months, what challenges do you see as the most daunting in terms of the vaccine, medical personnel, and what's your message to the public as we look ahead to the next 9 months of this pandemic?
So I think the message is stay with it and stay the course. We understand that there is COVID fatigue, but there is light at the end of the tunnel. I know that that light inspires me each and every day to double down our efforts to make sure that we do all we can for this community. The vaccines are showing real promise. So every day when you go out and you put this mask on, know that the days are numbered when you're going to have to wear this all the time. But that is still some number of months in the future. I anticipate when we hit the summertime and the fall is when we're going to start seeing the real first big impact from mass vaccination and immunity. And so people are going to need to stay the course. The second message is, again, we need you. We need you to do your part. We need you not to add to the pandemic and hospitalizations by doing the right things. And if you are interested in helping, we need you as well. Our hospital systems are going to be strained for the next few months. And as you heard Dr. Randolph talk about, especially in the next 6 weeks to 8 weeks, we are going to see a significant strain on our medical resources. So do all you can to avoid adding to the problem. We understand also that there are other complications that add to the funnel of people that come. It's not just people with COVID, people with just general underlying conditions. So if you're not worried about COVID, I would like to refer you to some information so that you are. But more people are familiar with the flu, and this is very effective. This mask is very effective at preventing the flu as well. So get your flu shot, wear your mask, and get tested for COVID. And when it becomes available, please get the COVID vaccine.
Dominique Dillon, Fox 13.
Hello. Let's see. So yesterday, the county commission discussed an ordinance that would fine people or businesses $50 for not wearing a mask. And I just wanted to know if the health department agreed with that. It was just a discussion, but if it were to move forward, would you guys be a part of possibly enforcing this move as well?
Dr. Randolph, you want to take that?
Yes, the health department will play a key role in enforcement of that ordinance, and we are in support of it. We're looking at the other ways. Currently, our options as it relates to people who violate the health directive is either to close them completely or do nothing. And certainly, we cannot tolerate not doing anything. And so we're looking for another option, other short of completely closure of the facility.
Oh, and then one more question. I know several businesses were closed over the weekend. Could you just elaborate a little bit on what are like most of the offenses you're seeing from them? Is it more not wearing a mask, or is it more of too many people in a business, or staying open too late?
Well, our investigators will respond to complaints, and we also do some random inspections. And we are looking for people adhering to the safety measures outlined in the health directive, which are wearing of the mask, maintaining 6 feet separation, no smoking, no standing, dancing, and gathering, and also no crowding. So the places that were closed were found to have violated some, if not all, of these measures.
Kendall Downing, WMC.
Hey everyone, good afternoon. First question is for Doug or Dr. Randolph about the alternative care facility. The way that it's kind of been described recently and what you were saying today is that the model for that building is not really something that could be feasible. So is it, safe to say that it's very likely the surge over the next few weeks will be handled by the medical facilities with the facilities they have themselves and not the state facility that was constructed? And then I have a follow-up question.
Sure. Well, let me just clarify a bit. It has always been the model here to handle the surge in the medical facilities that we have. So the best place to provide care is in the hospital systems that we have. And as you have seen through some of our reporting, we have two kinds of beds that we report. We have the staffed beds, which represents our ability to treat patients on a day-to-day capacity, and then we have a surge bed count. Surge beds are the physical limits of any particular facility to actually house people in beds with medical equipment. The idea has always been and will continue to be that as we can add staff and capacity to our existing to our existing hospitals, that we will staff them up. And the first wave of dealing with the surge is in the hospital facilities themselves. Only after we reach certain critical limits would we begin, and bumping up against capacity, physical capacity in the hospitals, will we begin to look at the alternate care site. Now, the opening and closing of the alternate care site is also dictated and controlled by the state, and they'll be looking at very specific things like staffing, capacity, and the rate at which the pandemic is growing. And so what I don't mean to convey is that anything has changed from the beginning. What I do mean to convey is that staffing is a challenge. As I said, early in the pandemic, when there were areas of the country that were not as affected, we had a pool of resources we could pull from in order to staff up things like alternate care facilities. Today, that pool is much, much more shallow, if you will, and so we are currently looking for other strategies that we can do two things with. Number one, add additional staff to care for patients in our hospitals, and then number two, should we need the alternate care facility, to find a way to staff that up as well. We do not have the complete solution, but we are working every day in order to work through those particular challenges.
Thank you. And this is for Dr. Randolph. Over the weekend, we got some video of a large party at a motorcycle club. We've taken calls from, other gatherings that are going on, very large gatherings that are still taking place, maybe not at a restaurant per se, but some type of a club or other sorts of things. I know yesterday the director mentioned that you all were working with law enforcement because of increased volatility around some of these enforcement efforts. Can you talk about, is there a stepped up effort right now to go out in the community and see what's going on with some of these gatherings? And is there going to be a law enforcement presence with your inspectors as they kind of deal with some of the escalations there. Thank you.
Okay. Yes, things have increased in terms of threats, and we are partnering with law enforcement to go with us when we visit some of these places, especially when it involves possible closure. Yes, we're stepping up our enforcement efforts, and we're particularly investigating the reports that we are receiving from citizens and from other individuals pertaining to gatherings and events. You know, the reality is that wearing of your facial covering, a face mask, maintaining separation of 6 feet, social distancing, not crowding and gathering, really are tools until the vaccine really takes effect. And so we really will need everyone to do their part by staying apart and wearing the facial covering. So we are intent on investigating and enforcing the safety measures outlined, all in an attempt to keep from having to go backwards. You know, there are cries throughout the nation that certain establishments ought to be closed. Well, we chose not to go that route, but we are implementing restrictions that will prevent us from going that route. So it's very important that everyone adhere to the safety measures so we won't have to close businesses and establishments.
I just wanted to add, so that's a really good question. And so just a couple of things. First, enforcement is great, but compliance with orders is even better. And so there are so many businesses out there who are doing this the right way, and so many people who are doing this the right way, and they are all working so hard to get through this. And then there are other folks who are trying to do whatever they can. Let's see what we can get away with and see what we get, just try not to get caught. I would encourage you, if you're in that latter category, to rethink things. The people in your community are counting on you to do the right thing, not for you to see what you can get away with. Second, if you see something, don't just assume that we know what's happening. Please take the opportunity to call 311, call the Mayor's Action Line, call the Shelby County Health Department, and make a report if you believe that someone is doing something that could be an event that spreads COVID-19. I realize that many people believe we have universal knowledge of everything that happens, but unfortunately we do not. And we rely a lot on the citizenry to tell us when things are happening. We have a limited workforce out there in the field. They are out there 24/7 working hard to keep us safe, but we just don't know everything. So please take the time to let us know if you see something.
Jane Roberts, Daily Memphian.
We've been hearing reports that there may be a change in the funeral policy. Can you comment on that?
Let me ask, what have you heard?
Just that there could be restrictions coming on funerals.
Well, per governor executive order, we do not have the authority to dictate to places of worship how they would conduct worship services, weddings, or funerals. So to answer to your question, no, there are not any plans to impose any type of restrictions on funerals.
Thank you.
Greg Akers, Memphis Business Journal.
Hi. Vanderbilt recently reported that delays in the state reporting new positive cases is averaging more than a week. And in response to that, Hamilton County, for example, has suspended its contact tracing program. What is the current time frame that the Shelby County Health Department is getting numbers from the state, and what are the ramifications of any delays?
Well, we will acknowledge that there have been some delays. I don't think our delay is quite a week. It's somewhere around 4 days on average. We're not there yet in terms of discontinuing contact tracing. Now, one of the things that we are doing, though, is placing greater emphasis on case investigation, identifying who are cases, who have tested positive, putting them in isolation. That is one of the reasons why I reached out to the broader medical community and actually granted them the authority to place individuals who test positive into isolation so that we can get them into isolation. The test that was conducted over the weekend showing that 16% positivity, and many of those were asymptomatic. So we're asking that the healthcare providers in the broader community, when you know your patients test positive, put them in isolation. As far as contact tracing, we are setting some priorities. First priority would be household contacts to cases, and then also secondly would be contacts to cases in congregate settings, such as working settings, living schools, as well as residential living facilities such as your nursing homes and assisted living, as well as the correctional facilities and jails. But we're still doing contact tracing at this moment.
Thank you. One follow-up, in light of, even with a 4-day delay, obviously we're coming up on 2 weeks since Thanksgiving when you would have expected to see a surge. Should we build in an extra 4 days, and when we're really looking at that incubation period to come to fruition?
Right. So if the incubation period is anywhere from 2 to 14 days, so we still got about 3 or 4 more days before we're 2 weeks past Thanksgiving, and so we can anticipate probably some increased numbers. I wouldn't be surprised.
We are out of time. Are there any closing messages today?
You could please pull up the "We Need You" slide again. Again, I'll implore everyone to know your status and go get tested. And if you have any compunction to serve, we need you and we can use you. You'll see the slide that is up there for the Tennessee Medical Reserve Corps volunteer program. There are paid and unpaid positions there. We'll be sending this out broadly. There's a QR code. There is a website that you can access there. So again, licensed medical professionals, folks who are retired, and people who just have the urgency to serve are welcome to apply there. We will put you to good use. Thank you.
Thanks, everyone. We'll see you back here on Thursday.